Well, less than 2 weeks after the government denied there was widespread public drug use inside BC hospitals, a new memo from Island Health today once again confirms that is indeed the case. For more, let's bring in Rob Shaw at the BC Legislature. Rob, tell us about this memo.
Well, April, Health Minister Adrian Dix keeps saying drug use is not allowed in hospitals, even though nurses saying it is happening all over the place. The fentanyl smoke is hurting their health, and it has gotten worse since decriminalization. Today, a new leaked memo from Island Health actually encourages that drug use, going so far as to say staff should help teach people with addictions how to inject drugs into their IV lines. The memo dated March 15th outlines care guidelines saying the goal is to reduce stigma and instead of requiring patients to stop using substances when they access care of services, a harm education approach offers ways for care to be provided whilst meeting individual patient needs. That includes, if encountering a patient using illicit substances, if safe, let the patient finish. And if a patient has an IV, provide education on injecting into lines and offer the patient a safe place to store their drugs or supplies. Now, BC's Nurses Union says its members are getting sick from all the plumes of fentanyl drug smoke in hospital rooms, bathrooms, and hallways. They've called on government to enforce that no drug use policy, especially smoking, as well as crack down on open drug dealing in hospitals. Here's the union today on that memo.
But it's missing how to keep nurses safe. And it does appear that it's providing allowances for consumption within the healthcare setting.
The NDP government's been on the defense over this issue all month since a similar memo leaked from Northern Health. BC police chiefs last week telling federal MPs they can't respond to drug use calls in hospitals because of decriminalization either. Dix today reiterating his plan for a task force to ensure the no drug policy is clear, though his critics say that is useless if there's no one to enforce the policy. Here's question period today.
Quote. The minister can say it isn't allowed. It is happening every single day in hospitals across the province. So when is this minister or this premier going to do the right thing, listen to nurses and healthcare professionals, and end this disastrous decriminalization?
We're going to continue to take steps to ensure that the rules are understood, that the rules are applied, and that protections for all patients that go in the hospital, every one of them, deserves care and respect. Every one of them will be enforced and applied, and we're going to continue to do that.
Island Health saying today that this memo is simply a resource document encouraging staff to talk to patients, to come up with a proactive plan, saying that if someone is using or suffering from addictions in the hospital, it is more dangerous not to talk about it than it is to try and approach it head on. April, critics saying allowing that use to continue is just as harmful to the staff that work there.